Thank you for coming.
Good morning. My name is Donaleski. I'm with AI Advisor Group and the creator of the Validated Mind. We help companies build a trust between strategy and execution during critical transitions, the moments where decisions matter most. And that leads to one question we're focused on as a company. What is a decision worth in the age of AI? Because AI can process the data, but leaders still have to make the call. To answer that question, I created the Validated Mind, our research lab studying the mechanics of human decision-making. We look at how risk is evaluated, how bias shows up, and how confidence gets formed or distorted when AI is in the loop. Our goal is to help organizations improve not just the quality of their data, but the quality of their decisions. That's the lens I'm bringing today's conversation, and I'm honored to moderate this panel. As we unpack the practical AI implementation, really looks at what, not the technology looks at, but what the decision, risk, and human judgment behind it. Now, we've got two outstanding people with us today. Each will introduce themselves and the work they do, so I'll keep this brief. First, Dr. Asif Ali, cardiologist, clinical researcher, and one of the leading voices driving AI innovation within the American Heart Association. Next, Salasakar, an engineer applying machine learning and deep learning across drilling automation, reservoir management, and large-scale energy deployment. Let's start by welcoming Dr. Ali.
Good morning, and pleasure to present this morning at Pumps and Pipes 2025. Pull up my slides here. Talking about data that drives LLMs and therefore improves reliability and outcomes. Okay. So these are my academic appointments, both at UT Health and University of Houston. I'm a preventative cardiologist at Houston Cardiology Consultants and director of Cena Research Institute, as well as a member of the Health Tech Advisory Group to the American Heart Association Center for Health Tech and Innovation, where I run their AI and digital wearables. Here are my disclosures relevant to this talk on AI. So the agenda, what we're going to talk about this morning is data that feeds LLMs and how we use that data for outcomes, and particularly for safety and efficacy and efficiency in the patient continuum. So we just need to look back at mortality, what is really driving death in the United States. And if you look here at all of these pathologies, one thing stands out, which is unintentional injuries are actually in the top 10. And I split it because I think women's health and men's health have to be split. But vehicle accidents are a major contributor in this category of unintentional vehicle accidents. And this just came out last week. If we look at self-driving companies like Waymo, they were one of the few companies actually to release their data covering nearly 100 million driverless miles for 4 American cities through June of 2025. And when compared to human drivers, you can see the statistics. Autonomous driver was safer than the human drivers overall. And so the reality check is, if AI can make cars safer, what can it do for healthcare? Which really looks at AI and the consistency of AI to yield fewer avoidable harms. But we as physicians and HCPs, healthcare providers, we must trust but verify. So I'm going all the way from autonomous vehicles back to fax machines. And why fax machines? Because they're considered HIPAA compliant, safe, and safety will always outweigh efficiency for the healthcare provider. Clinicians are not afraid of innovation, but we're cautious about the risk versus harm to our patients. It is the lack of trust that is the biggest barrier to adoption for HCPs, and I would say for patients alike. And we are trained on evidence-based medicine, guidelines, and peer-reviewed studies that create safety guardrails. Clinicians are not just end users, but we're the safety officers when it comes to digital health. So last year I published a paper in Circulation on looking at ChatGPT-4, Grok, and Gemini 3 LLMs in different fields of cardiology, actually looking at case studies. And we took published case studies and ran multiple questions for diagnostic and treatment of these 3 LLMs. And interesting enough, they hit the mark around 80 to 90%. But that wasn't good enough, right? And just so you know, GPT-4 was the winner out of these 3 LLMs. And our data was very consistent with hallucination rates across all LLMs, especially where AI models gave confident but incorrect answers. And interesting enough, not all AI models hallucinate equally. And that's why keeping the human in the loop is essential. So overall, what do HCPs, what do healthcare providers, I'm a cardiologist, what do my other cardiologist colleagues feel about AI? Well, the data was very clear. In the recent Congress, 33,000 attendees at ESC 2025, greater than 50% of cardiologists expect AI to be routine, especially in diagnostics, and expect 87% reductions in image interpretation time and a 30% reduction in unnecessary referrals, which means better triage and workflows, and improvement in risk prediction accuracy. That's what is expected. And what about patients? How do patients feel about AI? Well, no model has a 0% hallucination rate. And it is crucial for medicine for AI to be supervised, validated, and integrated within clinical expertise. And really what patients are saying is we trust the institutions that we go to, and we expect them to have vetted companies to make sure that these LLMs are trustworthy. In our paper that we published on hypertension in the AHA, we looked at generative and conversational AI computer models, and these were indistinguishable from the human counterpart. And furthermore, not just from physical health, what about mental health? So in our paper, we looked at a perspective of access of care for both, for patients for their mental health issues. And this was very well received by patients alike in LLM models. The AI-enabled patient clinical continuation loop. So these are 3 terms I've been trending about pre-engagement, engagement, and post-engagement. So I have very little bit of time here, but pre-engagement is the history intake before the patient sees the doctor. Engagement is what we know as AI scribing or ambient listening, and post-engagement is how do you create adoption of behavioral change. So this gives a little bit more detail. But I'm doing this now in my clinic, which is a pre-engagement tool. We've had about 2.5 million patients through this, and I'm able to filter data after I see the patient, looking at social determinants of health, GDMT, MD calculators, inclusion, exclusion inclusion for clinical trials before the patient sees us. We know in the engagements, ambient listening, and post-engagement is RPM and CCM. AI-driven imaging re-engineers precision, consistency, and personalization to every patient in every encounter. A couple of papers that we published on CCTAs and underrepresenting and overrepresenting their data, and also unmet needs in echocardiography, especially in low flow rates, for example, in aortic stenosis. There's a lot of area of need. AI is not about replacing the clinician, it's about replacing preventable harm. Thank you very much.
Good Good morning, everyone. My name is Salasakar, and I'm a petroleum engineer. And my talk is about AI applications in energy industry. When I say energy industry, I focus on oil and gas, but these applications are very similar in any subsurface energy management, such as geothermal energy or hydrogen storage or carbon dioxide storage in underground reservoirs. So to start with, I will start with some concepts of reservoir management, and then I will dive in modeling and simulation efforts, and then I will, in this context, I will mention how AI is applicable to our scenario generations and field development. So to start with, reservoir management is use of our human, technological, or financial resources in order to maximize our oil recoveries and profit while minimizing our costs. So on the left side, you're seeing typical cash flow of an oil field in its life cycle. So it starts with negative cash flow in early exploration, since we are still not producing oil and gas. But as we ramp up the production, we will start seeing the cash flow increasing. Finally, it reaches the peak and starts declining. So that's where you have opportunities for your reservoir optimization. And typically, reservoir optimization is conducted with the workflow that I have shown on the right side. So you have exploration phase where you collect a lot of data, you run various surveys, and then finally we have computer models that we build based on this data. And then we run simulations, and finally we use the results from simulation for our field development. So simulation is a two-step process. First step is creating reservoir models. That's where we have digital static representation of our oil fields or our reservoirs. And that's where we have our data incorporated, which is our geophysical, geological, or engineering data. And then we run simulations on these models in order to get dynamic understanding or how our fluids flow in our reservoirs. Together, we integrate our modeling and simulation efforts in order to get better understanding of our reserves and our resources. Then we use it for optimizing our production strategies. And finally, we use it for mitigating our risks and maximize our profitability. So modeling exercise has data coming from multiple sources. We run various seismic surveys, we have remote sensing surveys, we have geological maps, well logs, and overall it gives us the understanding of how our reservoir geometry looks like, where are oil, gas, and water located, and how the rock and flow properties are in these oil fields. So AI comes and solves four major problems that we have. It helps us in incorporating large amount of data to build data-driven models. And typically we can QC data using AI, we can see similar features, we can cluster similar features, we can see, visualize various patterns and trends using AI in this area. Then we use AI for our history matching exercises, which is typically our calibration and validation of our models. We generate multiple scenarios in order to understand uncertainties in our reservoirs and how uncertain parameters are distributed. And then finally, we are using AI for our production optimization also. So we combine AI algorithms with some optimization algorithms, and that gives us a better understanding of how our scenarios will maximize our profits. And it's helping us to solve we get three major benefits from these applications of AI. We have faster solutions, we have better production optimization strategies, and then we also have overall risk mitigation with the help of improved accuracies. So with that, I will show you a small example of how we are using AI. So we have this small reservoir, and this reservoir is a piece of an oil field where we are going to inject CO2. And this is showing you how permeability is distributed in the reservoir model. So the green area shows you the permeability, less permeabilities, and red areas are showing you how the channeled increased permeabilities are distributed. So when we run the simulation models, we will see how CO2 spreads in this reservoir, which is shown in the bottom picture in the blue reservoir. And now our goal is to generate proxies or AI models that replicate the same results, but in quicker ways. So it's a two-step process. In first step, we compress the data, and we turn this high-dimensional data into lower dimensions. And in second step, we use various AI algorithms to understand the dynamics of our system, or how reservoirs will behave, and how the fluids will flow, and how the CO2 will evolve with respect to time. So here is a small example of a snippet of how it looks like after 10 days. So first column shows you the input for our AI models. Second column shows you the simulation results, which are also input for our AI models. So we use these inputs and outputs for our AI to train the model. And AI replicates the same results, which are shown in third column. So then finally we get the relative errors, and it's acceptable the relative error is less than 1% and very acceptable. Then we repeat this process for 3,200 days and see how CO2 evolves in this reservoir. So you will see with the 3,200 days, we have similar results. AI replicates our simulation results very well. And we have relative errors which are a little bit higher because now we are testing data. Previously, we used the training data to replicate our images from our 10 days period, but now we have 3,200 days where we have evolving data coming from only AI model, and we are comparing it with our simulation results. And so finally, where we are heading in this space is we are using various AI models to understand the physics, the underlying physics behind these processes, and how we can leverage the advanced computing resources that we have, such as GPUs and quantum computing for creating our digital twins for these reservoir simulations and reservoir modeling efforts. And overall, right now at the moment, they are helping us to accelerate our workflows, generate and populate various scenarios for our reservoir models and simulation efforts. And that helps us for better decision making. And thank you so much.
All right, so I think we're at the Q&A session section of our session here, and we have a little bit of time, so we'll see if we can get to some Q&A from the audience as well. But the first question I'd like to ask is, and this is directed to both of you guys, AI is dramatically increasing the speed at which specialists can process data, model scenarios, and detect patterns. But speed isn't the same as expertise. In your field, where do you draw the line between AI accelerating your work and AI actually shaping the work? And what must remain in the hands of human specialists? Dr. Ali, you want to go first?
My mentors always taught me that subject matter experts, key opinion leaders are the ones that are asking the right questions. You have to ask the LLM models the right question. So it's the subject matter experts that can come in to answer very specific questions to yield the right answer. And you're right, it's not about time. I think in the presentation I was showing, we're still seeing AI wanting to give an answer, but having a quick, fast answer that is wrong is not going to move the needle for us, especially in healthcare where lives matter. I think the LLM models also, not just from a time standpoint, but making sure that you're inclusive of different various populations is extremely important. And some of our data that we presented on PPG, plethysmonography in digital wearables, those individuals that did not test their digital wearables on different skin tones, for example, like Fitzpatrick's scale, were inaccurate. So go back to COVID when darker skin tones like Fitzpatrick 5 and 6, we had pulse oximeters that did not work. There were literally people who had harm because the models were not tested on the population that they were meant to serve. Very important, it's not just about time, it's about accuracy and making sure inclusivity of different various populations, including gender, females, including different skin tones, is extremely important.
Thank you. Samir?
Yeah, so certainly AI is helping us in acceleration of our workflows and how we speed up these processes. We generate various models with the help of generative AI also. But you know, overall, we still, the more resources we have, the responsibilities are also increased in terms of what experts can do now. So now we can incorporate more uncertainties in our uncertainty quantification exercises, and then we also can generate various models, populate more models as geologists look into these various scenarios and possibilities. So in terms of acceleration, definitely AI is helping. But in terms of shaping, now the more is demanded from us in terms of how we quantify the uncertainties and how we mitigate the risks using these uncertainties. And in terms of humans, what's in the human hands? I will say judgments, decision making, and risk assessment is still something that we will need humans for. So yeah.
Thank you. And along that same lines, I have one more, which is AI can accelerate decisions, but acceleration doesn't guarantee the right direction, as you kind of alluded to, Dr. Ali. In your domain, how do you prevent AI from simply helping you move faster at the wrong thing? And what guardrails or expert judgment are essential to ensure that speed leads to better outcomes, not just quicker ones? Samir, if you want to go first.
Definitely it increases the speed, but we also need the domain expertise from our geologists and petroleum engineers to validate these models. And it's really important to validate these before going ahead, because wrong answers, fast wrong answers will basically generate the wrong decision making. We need to validate these models, understand if it replicates the physics behind these processes, because AI is a statistical tool, and it may give us very optimistic results, but it may not follow the physics behind the process or how these oil fields work. Yeah, I mean, we need the experts to validate these models in order to mitigate the risk of using wrong models for decision making.
Awesome. Thank you. Dr. Ali?
I'd say trust and verify, and also means test and verify, and absolutely making sure that we have benchmarks throughout that journey. And then lastly is, you said guardrails, and inherently our systems are already biased, and calling that out from the get-go and making sure we create those guardrails around biases around, and that could be a myriad of different areas, again, in genders as well as skin tones, as we alluded before, but making sure you call that out and creating those guardrails. And that requires the humans to really be a part of that system.
Thank you, guys. I think we're at time here, so we'll have to end it there, but you guys will be available afterwards to talk to. So thank you guys so much.